Hi, everyone. Welcome. We're so excited to be here with you today to talk about community-driven language access with practical tools and strategies from the Guatemalan-Maya Center. For those of you who may not be familiar with us, NCFH hosting your webinar today. We are a private not-for-profit organization located in Buda, Texas, outside of Austin. And our mission is to improve the health of farm worker families. And we do this across four main areas: capacity building, health promotion and education, farm worker outreach, and research and data collection. I'm really excited to introduce today's speakers to you. We have two great speakers coming from the Guatemalan-Maya Center. We have Mariana Blanco, who is a dedicated leader in her community and who brings a fresh perspective because of her drive to strive towards equity and her years of working with this community. Mariana was born in Mexico City at age 7, she and her family moved to South Florida where they planted roots. She became involved in the Guatemalan-Maya Center as a volunteer at the age of 15 through the center's after-school programs, known as the Escuelita Maya. Her passion for change and commitment to the community led her to Loyola University in Chicago, where she graduated with a double major in social work and criminal justice. In 2015, Mari came back to South Florida to oversee the after-school programs at the Guatemalan-Maya Center as the curriculum director. After a year and a half, she returned to Chicago to work in a shelter for unaccompanied minors under the Office of Refugee Resettlement as a family reunification specialist, where she gained the knowledge to be able to work with a diverse population with urgent needs. In 2020, she returned to the Guatemalan-Maya Center, where she currently serves as the Director of Operations. Mari currently also sits on the board of the Coalition of Florida Farm Worker Organizations, COFFO, which is a voting member of the District and Diversity Equity Committee for the school board. And she is a council member for Community Partners. And we also have Lindsay McElroy. And Lindsay has dedicated the past 10 years to serving the immigrant community in South Florida, beginning as a volunteer at the Guatemalan-Maya Center's after school and summer programs in 2015. She soon transitioned into a full-time role with the center, leading advocacy and health equity campaigns. She earned her master's degree with a thesis on the history of agricultural workers' labor unions in Florida, and later became a union organizer to advocate for workers' rights and political engagement. In response to the ongoing crisis, Lindsay has returned to the Guatemalan-Maya Center as the lead immigrant justice coordinator. So we have two very wonderfully qualified and experienced speakers with us today. So before I pass it over to them, I'm just going to go over our learning objectives for the session, and then we'll get started. So by the end of our session today, there are three main things you'll be able to take away. You'll be able to describe and identify some strategies for engaging community leaders and building community-rooted language access initiatives, including inclusive hiring practices. Identify low-cost practical tools and technologies that can support language access efforts in resource-limited settings. And we'll explore approaches for building strategic partnerships to advance language justice efforts. So please welcome our guest speakers. I'll pass it over to them, and please share your questions throughout the session in the chat, and we'll get to them later in the session. So I'll pass it over to Madi and Lindsay.
Thank you so much, Kadie, and everyone from NCFH. I'm gonna go ahead and share our screen to get started. Feel free to ask any questions, interrupt us as we're going. Definitely want it to be more of a conversation, and if we change topic, we might lose track of what you all are asking. So just feel free to ask the questions, and we can go ahead and answer them. I think Lindsay can get started with this.
Hi, everyone. Thank you so much for having us. I just want to confirm you can hear me.
Yeah,
Um,
we can hear you.
okay, perfect. So I'm just going to start with the birth of the center and really how we got started in South Florida. So although we were formally founded in 1992, our work really started in the 1960s with our founder, Father Frank O'Loughlin. He came to he came to South Florida from Ireland as a new priest, and he immediately began advocating for migrant farm workers with the United Farm Worker Union as they expanded to Florida, and he was leading boycotts for lettuce, boycotts for other agricultural produce that were picked in non-union farms, and he worked very closely with Cesar Chavez during this time. We always joke that we find it so funny. Cesar Chavez used to crash on Father Frank's couch when he was in town. So a lot of our organizing techniques has, been passed on from that early start with Cesar Chavez and the UFW. In the 1980s, a genocide began in Guatemala. So prior to that, Father Frank largely worked with Mexican and Haitian and African American migrant workers. And during the 80s, the first Mayan refugees started arriving in South Florida. He saw that there was a real need for support of this community. They came not speaking Spanish. They speak one of many indigenous Mayan languages, which we'll get into later, and there wasn't social services that were accessible to them, and there weren't people to help them. A lot of these people actually ended up coming because there were radio stations played on the border that would talk about the migrant priest in Indian Town. And so people came searching for the migrant priest. And a huge Mayan population came to South Florida seeking refuge with Father Frank. And so he responded to their need. He was already the head of Migration and Refugee Services for the Archdiocese of Palm Beach County, but then he formally incorporated the center itself in 1992 with the first mission to provide equitable health care to farm worker women, largely indigenous Mayan women. And that was because there was really a lot of issues with them not receiving prenatal care. A lot of the babies were being born premature, ending up in the NICU, and the woman didn't have ways to communicate with their doctors. So it started with a bunch of his friends who were indigenous Mayan women who could translate language and culture, and the center was built off of that.
Oops. Yeah, so who do we serve? We, of course, as you heard from Lindsay, we are the niche home to the Indigenous Maya. But in the past, in the 4 decades that we have been operating, we have been serving people from 28 different countries. It really depends on the migration patterns, what's happening in the world. That is who we serve at that time. Primarily, our services are to non-English speakers and migrant refugees. Currently, we are serving annually approximately 16,000 families. We have around 38 staff members, and our programs range. Really, we take pride in our programs constantly changing and evolving based on the needs of the people. And so we really do believe in following the people, not the money. And that's kind of how we base our work. That's one of the ways that we have structured our programs and have really built trust within the community. So our more stable programs or pretty permanent programs include after school programs, early literacy programs, food distribution, our program, which we call Outreach, which honestly is the program that does a little bit of everything. It just depends what people come in for. And our Clínica Maya, which is a clinic, pop-up clinic that we opened a couple of years ago to specifically to answer the cultural barriers and the cultural gaps that we see in the healthcare system, and to meet language justice within the healthcare system. So our programs, while they do vary depending on the needs of the people, we try to really make sure that we are focusing on language justice and culturally competent services. And so for us, in any given day, we could be doing missing persons, we could be doing an interpretation for someone. We are pretty flexible in in a lot of our programs in the services that we could do to make sure that we are not just working in our own home base, but that we're able to target other agencies to meet the needs of the people. And so I'll talk a little bit more about that when we get to our strategic partnerships. But some of those examples are currently we're working with a DCF, a case of that DCF is leading, a mom who just lost her 10-month-old baby. And I'm sorry, she just lost her 1-month-old baby, and her 10-month-old baby was removed by DCF. This mom only speaks Canjobal. And of course, even just getting the 911 to respond to her infant was very difficult. But one of the things that we've seen in the involvement is that there are huge cultural barriers that are negatively impacting how DCF is working with this mom and viewing the case. And so certainly in this situation, we, will accompany her as her advocates, but also make sure that during her case, she gets access to an interpreter, and that services that are being provided for her or that are being required from these government agencies are culturally sensitive to the needs of the mom. Language justice really does take part. I think probably all of the agencies that are on this call will know that it takes, it takes part in every single portion of our work, but it really does matter that agencies are strong in advocating for the community in that way, because otherwise government agencies or whomever, is leading efforts and in the work that they're doing are not going to know what the needs of your communities are. And so that's just a little bit about our services and who we serve here.
But we find that the majority of our people, there's low literacy in the community, and they don't really go on our website to access resources. We do everything through organizing word of mouth. So we have dedicated community leaders who share information, distribute information. We use a lot of audio messages and videos to make sure things are as digestible as possible to our people in the Indigenous Mayan languages. And we're always an open door. Everyone has our phone number. Most people have our cell phone numbers as well, where they can call us and access those resources. So to access our site in Spanish, people just call us for everything. And we will support them no matter what. And yes, we use WhatsApp. We use simple texting, but it costs money. But we have huge group chats in WhatsApp with our families. And that's our primary form of digital communication with them right now. And we also have a lot of connections with radio stations.
Yeah, we'll talk a little bit more about our the platforms that we use and what we would use them for. So we'll go more in depth about that as
Yes,
well.
definitely. So the building your leadership is really about choosing leaders from within the community who are from the community. We find that often a lot of agencies might require a bachelor's degree, a master's degree, and we've spoken to them and we advocate and tell them that the most important part of a staff member is that they have the cultural and linguistic competence to work with our families. No amounts of education will ever teach someone what it's like to grow up in that community and how to fight for your own people. So that really is very, very important to us. When Father Frank started the center, he is, of course, from Ireland and he speaks limited languages, but he built a large community of women. He was primarily women, men and women, but a lot of women he was working with who were advocates in their communities. They were mothers, they had wide networks. And so he brought them in and organized them and showed them how they can use their strengths to advocate for their own people and do interpretation so their own people have better access to resources. So that's really important for us that the Indigenous community can navigate resources because we often find that, sometimes someone might go to a doctor's appointment and they will tell them they speak Spanish and they'll keep nodding along. And then afterwards, they'll come to us and they'll say, I have no idea what happened at that appointment. And so we want to educate as many agencies as possible. Like you need to make sure you're speaking the true language of these people, instead of just assuming that everybody speaks Spanish.
Yeah, and that's really how our center started over 33 years ago when Father Frank was helping folks win their am or get their amnesty cases, win their amnesty cases. Those first women are the ones that he brought in to navigate the recent arrivals. At that time, it was doing prenatal care, so he was having the women whom he had already kind of formed a relationship with. He was having them drive the recent arrivals who were pregnant to their OB appointments. At that time, the NICU was overwhelmed with premature babies, and they had a real problem. There were major cultural barriers and, of course, language barriers. And so these women served as the cultural brokers per se, right? They were helping them navigate this kind of Western medicine that they were being introduced with. So that that problem was solved through the work of the center. And so with that's kind of formed the framework for how we build our teammates, right? Our staff, how we do our hiring process and what we look for. As Lindsay mentioned, it really is important to have Indigenous voices in amongst our team, making sure that there are people from within the community that are navigating the community, right? Lindsay and I are kind of an odd duo to be giving this conversation. We really are just the admin. We do like the background work, everything that comes with running an agency. But it really is our teammates whom we look for guidance and in the programs that we're building and in making sure that we are adequately responding to the needs of the community. Oops, and so I'll change that. But some of that looks like making sure that one, you're not just building your team, right? You can be hiring somebody that might not have the credentials, right, that Lindsay mentioned. They might, have not gone to pursue their higher education, but they do have an additional language that they speak, and certainly they belong to the community. And so making sure that we hire someone that has, that kind of lived experience and the language and the culture, that kind of knowledge is a lot more valuable because we know now we can nurture their public speaking and their writing. Like we can help build all of that. But ideally, we want to make sure that our programs, our program directors belong to the community and have that kind of experience. Also, making sure that we have that kind of leadership in our board is really important. But here's the thing, right? A lot of us work under grants, and we all know that funders are not they're very bureaucratic at times, and funders typically do require different levels of higher education depending on the job that is being required. And so in our own center, we've had to have these difficult conversations. One of our largest donors is very bureaucratic and certainly requires, in our largest program, to hire folks who have certain degrees in very specific areas. For us, when we started doing this work many years ago, it was more important to make sure that we could match the language of the home to the case manager we were bringing in the home and the culture than to have that higher education. And so that's sorry, yes. So that's one of the conversations that we've had to have with our funders is really advocating for our staff to make sure that they are accepting or that they are acknowledging that cultural knowledge and that lived experience is just as valuable, if not more valuable than the degrees that they require. The other thing that really had to be advocated in this specific situation, it was the salary, right? Because now these funders were suggesting that because our staff didn't have the qualifications that they were requesting, that they might not meet the salary requirements that some of the other agencies that are doing the same work have, and that was because they, the argument there was that the other org agencies had those degrees and our team didn't. And so really it was a conversation that we had to have, and we brought data to back it up, but our results were ultimately what led to our staff having adequate pay, the same pay as other agencies, and for them to acknowledge that this was ultimately more important than having those degrees. So it really is going to fall on leadership in your agency. Maybe some of your board members would have to have those conversations, but in order to effectively organize the people, it definitely matters how you're structuring your agency. And having those conversations with funders is going to be key to making sure that your staff is that you're building an adequate team to serve your community.
Great. So I'm going to go into some specific ways we do successful outreach and really how we participate in our organizing campaigns. So it's a little bit about what I said earlier, how, we don't usually disseminate information to the community we serve specifically through our website, but rather in person and through, technology platforms. So a really major way is our physical outreach in the areas where our families frequent. We think this is one of, the most important ways to communicate with people. We have appointments at our center every single day and people just coming in without appointments. So if you ever are in South Florida, hit us up. We'd love to give you a little tour, introduce you to some of our families, and you'll see we can already do a lot of organizing and education within our office or in our food pantry days. Because there's a lot of people coming through our center. And the food pantry days, it's over 1,000. On every other day, might be a couple hundred. So we're really busy and we're able to disseminate information that way. But we really work with a lot of undocumented immigrants. And so it's very important for us, to reach out to recent arrivals who might not know we're around, to, find people who may not know that they have resources. So we found the gas stations where a lot of our farm workers cash their checks on Fridays. The bus will bring them, they all cash their check, and we will go there on those Fridays in that like 1-2 hour period, and we'll be waiting to, we'll give them little flyers. But again, as I said, there's low literacy. That flyer is the main part of it is our phone number. So we keep things very simple and we have quick conversations like this is how we can support you, call us. We also go to the laundromats in the community. That's very common. We do a lot of outreach in schools. We've been lucky to have great partnerships with the school board, who has allowed us to have specifically nights for the Indigenous Mayan families to cater towards them and make sure there's interpretation in all of their languages. So, or in as many languages as we could help provide, and where the school board and the teachers and principals are answering questions for our community. So we really are at places where people frequent, and it's especially important now during the immigration crisis in Florida. It's really horrible. There's been a lot of ICE raids. And so we find that because we have this intimate knowledge of our community, we are able to still organize effectively, even when the people are more afraid and are leaving their homes less often. And then we also have a lot of technology we use. So we use simple texting, which is the one on the end, because that's the most expensive for outreach. And, if it's not being funded, it's pretty difficult. But what we liked about it is we have over, I think it's like 7,000 phone numbers in it. We can send out a mass message to inform people about something urgently, and it really disseminates widely. But we also use WhatsApp group chats. That's really big. We have a very popular one right now where we do daily patrols to see where ICE is in the neighborhood, and we let our community members know what intersections ICE might be at so that they're kept safe. And we can show you, if you'd like, how we structure those WhatsApp group chats, but basically we are the admin on it and we're the only ones who are allowed to send messages. The community members themselves can't send messages, but they can add people to it because, we want them to continue to spread the message. And then we also social media. So social media is really big for the different demographics. We find that a lot of our middle-aged community members use Facebook. And so we have our main Guatemalan-Maya Center Facebook page, which you all might have seen before. It's mostly in English, but pertinent information we do in Spanish. And then we also have a second Facebook page called Centro Maya, which is entirely in Spanish, and people have to add us as a friend. And we disseminate information exclusively in Spanish on that page. And then we also have Instagram, which a lot of our teenagers use. And we really try to organize amongst the youth in our community. A lot of them have status, they're citizens, and they really care about their families. They want to fight for something and they don't. So we are really expanding our youth services right now to organize to incorporate them in these sort of advocacy campaigns. And we have they just our high schoolers ran a summer camp for our little after school kids, the same way Maddie and I did. But now high schoolers from the community ran that summer camp. So it was really beautiful. But these sort of organizing techniques are really important to make sure we hit people from as many angles as possible. And we find that essential. And the final one, which we didn't put as a bullet point, but because it's related to everything in this presentation, is finding effective community leaders. You know, lots of the families I know and they trust me, but if my friend Olga, who's been living here for 25 years, can reach out to her cousins and brothers and sisters and all the people she knows and invite them to events, inform them about things, she's going to be a more trustworthy source for them. And so we identify community leaders constantly, and we have them disseminate information and recruit people for as anything from attending a medical clinic to try to get your pap smears to, participating in a rally at City Hall for housing and affordability. It's just expansive, the kind of things we work on.
Yeah. And for all of these forms of outreach that Lindsay has mentioned, we are very thoughtful in who we are targeting for that specific source of outreach. For example, our WhatsApp groups that Lindsay mentioned, the WhatsApp groups primarily serve the purpose of protecting the community. We don't publish those anywhere. We want to make sure that it's solely our community members that are engaged in those groups. Whereas to simple texting, we have, all sorts of folks sign on. Anybody can go on our website and register and sign on to our simple texting. That's usually where we have information about what's happening. If there's like for Zika or COVID, we were doing a lot of outreach via simple texting because you can reach lots of people in a very small amount of time. But our WhatsApp group would really be more local, making sure that it's, reaching folks in an area where it's intended to be, mobilize them really quickly. And of course, in all of these forms of outreach, we always make sure that we are sending lots of audio messages, or if it's physical outreach, bringing our teammates who speak those languages of the folks that we're trying to engage. Whenever you speak to someone in a language they understand, they'll comprehend what you're saying. But if you speak to them in their native language, you're speaking to their heart, so it forms a different kind of instant connection there. All right, so our strategic partnerships, how do we engage other agencies in making sure that they too are focusing on language justice? We, of course, as we mentioned, started off 33 years ago over that, but working with St. Mary's Hospital. St. Mary's Hospital had a very niche problem, right? And so they called the person who they thought could fix it, and he resolved it by bringing in the women to navigate the recent arrivals with language and culturally sensitive practices. And so that has really continued. We really make sure that, one, we are not changing the way that we do our services. So it's much easier said than done, but you really do have to follow the people and not the money, because the money will always change the way that you are structured as an agency. But you also have to be very flexible in your work, right? So and a lot of other agencies might not have this kind of flexibility, but we do have the flexibility amongst our leadership and our board of directors, in which they allow us to operate in this way. When we start, we've always been a frugal agency, so I should start off by saying that we know how to do a lot of stuff with very limited amount of funds, and we've kind of kept that model. So in engaging other agencies to work with our community, we offered our center, we offered our space. So we said, hey, we'll do the outreach for you, we'll bring the interpreters for you, we'll loan you the space at no cost, but you provide a service. And so that kind of was our model 33 years ago, or over 4 decades ago, when we started doing our work. And it's still our model now. We recently moved into a brand new building with lots of, significantly larger than the building we have been in historically. But this building really allows us to be that kind of community center. So on any given day, we'll have legal service providers here, we'll have paralegals here, we'll have pop-up clinics, we'll have county services, we'll have food distribution. And so it really allows our center to be a one-stop shop. And in all of the programs that we're doing, the reason that we continue to build really strong partnerships is because we are very flexible. We'll make sure that we always have interpreters available. And so we're not just there providing the service, but we are the ones that are navigating our community. We're always going to know what's best for our people. We're always going to be the most knowledgeable in terms of what the people need. And there's going to be times where, as Lindsay mentioned earlier, our folks are not going to speak up. They're going to say yes. They're going to answer yes to everything. And so we really have to make sure that we are available to help navigate those situations. So currently we have over 24 partnerships, and that ranges from like universities. We have universities in which we're doing research with, other universities and that are funding some of our programming. We work with lots of hospitals near us, doing prenatal care and other work. Hospitals will call us if they have like a John Doe or a Jane Doe, because we'll always make ourselves available for translations, for interpretations. But also for agencies, that's going to be difficult to navigate, right? How do you know when to charge agencies and when to offer services for free? Whenever we are thinking of a family, of one of our families, our clients, which we call families, we are not charging them. Like, regardless of the service, we're not charging them. If it's an agency that we know has the funds to cover that, we will charge them for those services. But if it's a nurse that's calling us because she's just trying to do what's best for her patient, that's ultimately up to the agency to decide. We'll never charge them for that, because they are going out of their way to make sure that this patient has access to their appropriate language. And so we want to make sure that we can provide that to them. So it really is, it's a little bit difficult to navigate these situations, but really just making yourself as flexible as possible will guarantee that other agencies will want to continue working with you. And that's how we really have built a very strong team of partnerships, not just here in Florida, but we have other partnerships that go across state lines. So that's kind of what we do. Okay, and I think the last thing we'll talk about, and we included this because it's a very clear example of why it matters to really advocate for language justice and for cultural competency in work. And this is a case that we worked of a Maya Mam teen named Virgilio, who was being charged with manslaughter. He was in an altercation up in St. Johns County. let's start off with what he was doing. He was standing outside of his place of residence talking to his dad on the phone when a sheriff in St. Johns County approached him, automatically, said that he was a suspicious male, called for backup, and started interrogating him. Virgilio is a Maya Mamtin. He didn't speak English, let alone Spanish. He didn't speak Spanish, let alone English. He speaks Mam. And so in that altercation, he kept repeating that to the officer. He kept saying, no English, I'm sorry, and just repeating that over and over, saying phrases that he knew, right? Family, please stop. That altercation escalated. It lasted over 8 minutes. Virgilio was tased. The backup officers came. And so he was severely beat. He was choked, ultimately leading that initial arresting officer to suffer a heart attack, and he died. And so with the death of the sergeant, Virgilio was now being charged, and what which the sheriff's department at St. Johns County was trying to do was send him to prison for life. They wanted to send him to prison for life. When the story broke, the story was completely different, right? The sergeants had a press conference, and they said that there was this illegal alien, this illegal immigrant that had threatened one of their officers with a knife and ultimately leading to his death. So that was kind of the narrative that was being told. The public defender's office reached out to us, and that's how we got involved. And in talking to the public defender, she reached out to us because she found us on Google and our name said Guatemalan-Maya. And so he's like, okay, maybe these folks from Guatemala will help me navigate the case. But ultimately, when we were talking to her, we said, is it that he is mentally incapable of understanding, or do you think that he might not speak Spanish? We think that he might be indigenous. So the public defender said, I didn't even consider that. And that's when we learned that he is in fact indigenous and that he spoke Mam. And that's why the public defender's office wasn't really getting anywhere with him. Virgilio didn't realize that he was signing his arrest, right? That he was agreeing to releasing his rights, and he didn't know any of that. So he signed, and he was taken to jail, where he sat for almost 9 months. And so when we got involved in the case, we decided that this was something that we were going to task ourselves with getting to go viral, because otherwise Virgilio was going to sit in prison for the rest of his life for a crime that he didn't commit. And that's what we did. We made sure that folks knew, one, that he was not Hispanic, he was Indigenous Maya Mam, that he didn't speak Spanish, and we also made sure that that video went viral. We went as far as to testify in Virgilio's case, which was completely composed of the sheriff's department. They really wanted justice for their officer, and that justice for them looked like putting this indigenous teen in prison. And so in making sure that we were, staying in track of what we wanted the world to know about Virgilio, we were able to get enough support from our a petition that we started, to where Coldplay reposted our stories, Kim Kardashian reposted our stories, and that's how we were able to get the representation of attorney Jose Baez, who almost instantly was able to get those charges dropped. We knew we needed a very powerful attorney to kind of be representing Virgilio pro bono, but otherwise Virgilio wouldn't have had another alternative, right? He would have just been kind of forgotten, and would have been spent the rest of his life in prison. And so that's what we did. We were able to get the charges dropped, and now Virgilio forms part in our community. We brought him down to Lakewood, and he forms part of our community. But we really put the story in because I think that this is the clearest and best form to say that it's not just about language justice and about making sure that your services are culturally competent, but really advocacy is a big part of the work. You can't have language justice and you can't provide culturally competent services if you don't consider advocacy a part of your work. It really goes hand in hand, and it has to trickle from the top down. So yeah, that I think that's all I'll say about that. If there's any questions from anybody, or if we didn't cover something that y'all want to hear about how we do, yeah, feel free to ask us.
And I want to add that we make, as we said earlier, a lot of messaging in the Indigenous languages. We do voice notes and videos, and we don't have this part of our website up yet, but when we do, we'll share the link. We're going to have a resources page so people can download messaging in the Indigenous languages about hurricane preparation, about immigrant rights, things like that. So it's just a resource we want to offer in the future for everyone and not just for our community.
Sorry, and then one last tip. I think, probably all of us are sharing that same kind of fear and anger that we're seeing and what's happening in our communities. And one of the forms that we have found in protecting our community when mobilizing, and this is using WhatsApp, is sometimes we want to make sure that nobody that's not meant to access these messages accesses the messages, and so we'll send whatever message we want to relate to our community as audio messages in the different Indigenous languages that our community carries, and that way we can guarantee that only the folks that understand these messages, I mean these languages, also get a hold of our messaging. So that's kind of one of the ways that we also navigate protecting our community whilst doing the outreach.